I was born and brought up in Meerut, and I did all my education from Meerut, starting from nursery till my post-graduation in surgery from Meerut Medical College. After that, I am trained in laparoscopic and minimally invasive surgery from Bombay. After completing my training in minimally invasive surgery, I started my practice in Meerut in 1994. It's almost 2.5 decades now. I've been serving the population of this area with the advanced technology of minimally invasive surgery.
I am Dr. Monica. I was born in Meerut. I did my schooling from here and I did my graduation and post-graduation on LLRM Medical College, Meerut. And I took training in laparoscopic from Kiel, Gießen. That is in Germany. That was some 10 years back.
We started this hospital as a purely elective surgical center where we do not take in any emergencies and we perform all sorts of minimally invasive surgeries. So all the surgeries are elective in nature and most of the patients have a hospital stay of 24 hours. So essentially you can say that it is a daycare center where we have a very high turnover. If we operate 4 patients today, we send them home tomorrow. So the hospitalization costs as well as the trauma to the patient is very less in this form of surgery.
This place was started in 2009. Though we are into practice since 1997, but this Star Hospital was conceived in 2009. Before that we were doing freelancing. It was only after we brought the Karl Storz OR1 from Germany that we installed it in our hospital and started the Star Hospital Laparoscopic Center. This is exclusive laparoscopic center where all invasive, minimally invasive surgeries are being done. And it is a purely elective center, no emergency work is being done here.
Well, we are providing all minimally invasive procedures under one roof, which include laparoscopic general surgical procedures like GI surgery, hernia surgery, solid organ laparoscopy including spleen surgery, kidney surgeries. Then there is laparoscopic gynecology where we have facilities for hysteroscopic surgery, colposcopy, laparoscopic myomectomies, laparoscopic hysterectomies, diagnostic procedures for infertile couples and removal of ovarian cysts, and we also do surgery for cancerous patients who have cancers of the uterus or the cervix. Then the other part is endourology where we do all minimally invasive procedures like PCNL, URS, TUR and uretolithotomies. Then proctology, we have a special proctology clinic where we perform stapled embroidered surgeries, we perform video assisted anal fistula surgeries, we perform banding procedures, infrared coagulation and STAR procedure which is there for obstructive defecative syndrome. Then we also do video assisted thoracic surgeries. Single port surgery is our specialization. I was the pioneer of single port surgery somewhere in 2007 and I have presentations in national and international conferences on single port surgery. Recently, about 2 years back, we have started bariatric surgery which is the need of the hour. Bariatric and metabolic surgery is essential for morbidly obese patients and it has a great health benefit. These are the specialties which we cover.
As far as I am concerned, we are doing gynec surgeries. Obviously, we are not taking up much. It is only the gynec, hysteroscopy, laparoscopy and colposcopy that we are doing. I have a colposcope here by which we are doing the checkups of all the ladies for cervical cancer screening. Then hysteroscopy, both the office as well as operative is being done. And laparoscopically, the maximum work that we are doing is myomectomies, fibroids, hysterectomies. So to sum up all, and plus diagnostic laparoscopy for infertility as well. Workup of patient, infertile couples by laparoscopy.
Laparoscopy basically means lapros is abdomen and scopy is to look into the abdomen. So it is a rod lens mechanism which is put into the abdominal cavity or any hollow cavity of the human body, and a camera is attached to it which can show us the internal view of the patient's body. The steps of the surgical procedure are the same as that in the open surgical procedure. The only thing is the method of doing the procedure is different and it is less traumatic. The patient does not have much of pain because the cuts on the human body are small. And the advantage to the surgeon is that the magnification which the video cameras and the laparoscope offer is 20 to 120 times better than what we see with the human eye. So the safety of the procedures is more, and we can perform almost every procedure which can be done in open surgery. We can perform it laparoscopically. Well, we have a fully equipped operation theatre which has a OR1 system, which is a high-end Karl Storz equipment which we imported directly from Germany. It provides us the facility to get 3D images as well as high definition images. We can provide these videos directly online, and we can view these videos from any place in our hospital. We have a high-end Siemens C-arm which is used for endourology procedures. Then we have state-of-the-art anesthesia machines, and we have an intensive care unit which we essentially use as a post-operative ward, which is equipped with ventilator and monitor beds with central oxygen and suction facilities. On top of that, we have a well-trained staff which takes care of the patients by giving them a personal touch. Essentially, in this hospital, almost 98% of our procedures are minimally invasive. So we do not do any open surgical procedures here. We do everything video assisted or minimally invasive. So the patient has less of injury because of the surgery. Therefore, the recovery is very good and the patient goes home the very next day. That we do not take any emergencies. We do not take any infected patients. So what we are doing is, we are doing very clean surgical procedures here which are minimally invasive, so our patients do not require much of antibiotics, much of pain relief drugs, and they do not require a long period of hospitalization. So this is the essence of this center. Essentially, this is a daycare module where we operate and send the patient home the very next day.
This is basically an exclusive laparoscopic center, a minimally invasive center where everything is being done by the minimally invasive scopes, endoscopes, which you call durbin in common language. So this is one of the first one, a pioneer. We are pioneers, we can say, in laparoscopy. We have all the scopes, right from cystoscopes to colposcopes, hysteroscope and laparoscope. So basically this is just an exclusive center for minimally invasive, where general surgery is not done that much. We are concentrating on the minimally invasive surgeries.
Well, the aim of the hospital is to provide best-in-class services at affordable costs. If we consider the costs in Delhi NCR, then we are doing procedures for less than 50% of what the patients are being charged in corporate hospitals or in larger centers. This is essentially because we have cut down on a lot of paraphernalia which is required to deal emergencies. So our running costs are affordable. That's why we are able to pass on the benefits of price reduction to the patients.
Aim is to give best international care and the best what we can give, whatever is available in the world, to our patients here in this small town of Meerut.
I can say, since we are running a small center, the personalized care to the patient is our USP. And one more thing which I would like to add here is, we are not competing with anybody. We are competing with ourselves. What we are doing today, we should be doing it better tomorrow. That's our motto. We have a fully trained operative assistant. We have a trained nursing staff in our hospital. We have the best trained anesthetists available in the town as our team members, and we are very confident about the capabilities of our team.
Our team comprised of a surgeon. My husband is a surgeon. He is the captain of the ship. And then I'm the gynecologist, and we have a very dedicated staff, really trained ones, and all exceptionally good in their services to the patients.
We have trained almost 10 surgeons and gynecologists in the art of minimally invasive surgery. We have had international and national publications. We have been faculty to a lot of national conferences, and we organize a live operative workshop where we do demonstration surgeries every year. This is for the benefit of spreading the knowledge which we have acquired over the last 23 years.
My achievements, yes, we can in the small town of Meerut, which is not a metro, we have bought the facility of laparoscopy. We have this Karl Stoss Operation Theatre 1, which has been bought from Germany directly. It is imported from Germany. I can say this is a big achievement. Person from the small town went all the way. I went to Germany, learned the skills, and even got the instruments from there. We didn't take anything local from India or any local town. We have bought all instruments from abroad. And we are trying to give that service here. I think that's quite an achievement.
Future plan is always expansion, add more infrastructure beds so that we can provide facility to more patients, and start a formal teaching and training program where the postgraduates in surgery and gynecology can benefit from state-of-the-art training facilities at our center. We are looking for recognition for our training center from the established bodies in India. Once we get that recognition, we will announce the starting of a formal training center for new surgeons.
The future plan is just to upgrade and to keep myself abreast of the latest and try and give the latest to my patients here.
The methods are different, the surgery is the same. Have trust in laparoscopic surgery because there are a lot of things which are misconceptions which are there in the general public about laparoscopic surgery regarding safety, regarding vision. People say that you cannot see everything in laparoscopy, whereas I would say it is a magnified view which you get. So laparoscopic surgery is safe. It is the need of the hour where the lifestyle is fast. People want to get back to their work fast. It is cost effective. It is the benefit of technology. It is just like going to Delhi from Meerut. You can go by a bicycle, but it will take you 4 hours, maybe 5, and you will be tired by the end of the day. Or you can go by a taxi where you can enjoy all the benefits of the air conditioning and reach there in good shape. So that is the difference between open surgery and laparoscopic surgery. The recovery in laparoscopic surgery is fast. So these misconceptions about laparoscopic surgery should be tackled properly. And the only thing is that you have to choose a well-trained and experienced laparoscopic surgeon for your procedures. It is absolutely safe method of doing so.
Viewers, I'm really happy to be interacting with you people here at this moment. I'm a gynecologist, a doctor. Besides that, I'm also a mother. So I have to keep shifting my load from family to the profession. But whenever I deal with my patient, I try to give them the best.